Hi, my name is Nadia Lopez, and today I'm gonna talk about anticoagulation with or without clopidogrel after transcatheter aortic valve implantation. Definition: clopidogrel is an anticoagulant that is administered in patients after transcatheter aortic valve implantation, which is a procedure that replaces your diseased aortic valve with a man-made valve. Your aortic valve controls blood flow from your heart to your body. If your valve becomes stiff, you have a condition called aortic stenosis. Your heart may have to work too hard to pump blood through the small valve, opening to the rest of your body. This may lead to increasing heart failure. In the picture, we can see a healthy valve and a diseased one. We can see here how the device is put on the aortic valve.
Transcatheter aortic valve replacement is for patients that have severe aortic stenosis and can't undergo the standard open heart surgery. Transcutaneous aortic valve replacement, or TAVR, is typically done through the femoral artery, which is at the groin site, and a catheter deploys the new valve via that approach. It no longer requires true opening of the chest. The patients that are best suited for this are patients that are elderly, frail, or other comorbidities such as severe COPD or lung disease, or severe calcification of the aorta, which would be too complicated for open heart surgery. There are multiple benefits to this procedure. Typically these are for patients that have severe symptoms such as shortness of breath, passing out, or chest pain. So when replacing that valve, you alleviate those symptoms. You improve patients' quality of life, but you also reduce their chance of death. It has both quality of life features as well as survivability improvement. If a patient is defined with severe aortic stenosis and deemed a possible candidate, they should be referred to the structural heart team, which includes cardiothoracic surgeons and interventional cardiologists at TMH Heart and Vascular Center.
Applications in medicine. Studies have shown that after an aortic valve replacement, the incidence of bleeding is major. That's why clopidogrel, an anticoagulant, is administered after the surgery. A study showed that bleeding occurred in 34 of the 157 patients. This means 21.7% receiving oral anticoagulation alone, and in 54 of the 157, This means 34.6% receiving oral anticoagulation plus clopidogrel. In patients undergoing TAVI who were receiving oral anticoagulation, the incidence of serious bleeding over a period of 1 month or 1 year was lower with oral anticoagulation alone than with oral anticoagulation plus clopidogrel.
Clopidogrel is a prodrug that must first undergo hepatic metabolism to cause an active metabolite. Clopidogrel in its active form then irreversibly inhibits the receptor on the platelet cell membrane, consequently deactivating the effect of the G proteins on the membrane, leading to an activation of the enzyme adenylate cyclase. This restores the production of cyclic AMP within the cell, which then causes the phosphorylation of the vasodilator stimulating phosphoprotein, or VASP, causing a decrease in activation of the fibrinogen binding protein and COX-1, or cyclic oxygenase 1, and consequently leading to less platelet aggregation by the platelet cells.
This was the mechanism of action of clopidogrel. Pros and cons. Pros. Technology, imaging analysis, and operator expertise has reduced the initial worrisome higher complications. It's a minimally invasive and life-saving treatment in patients with aortic valve stenosis. Clopidogrel can be an anticoagulant treatment for patients who had severe bleeding. Cons. Aortic valve replacement can lead to problems with the replacement valve, such as the valve slipping and leaking, heart rate abnormalities such as arrhythmias, heart attack, infection, even death. Clopidogrel have rates of impairment combined with other drugs, which causes an increase in the bleeding rate and decreases survival. It is not highly recommended. In the picture, we can see a normal aortic valve when it's open and how it looked when it's closed. It should apply in Ecuador. Regarding the causes of valve disease aortic, the prevalence of stenosis in Ecuador increases with age and occurs in approximately 25% of the population over 65 and in more than 48% of people over 75. While aortic insufficiency has a prevalence that reaches 30% in patients older than 65 years. This rate means that in Ecuador, the replacement of aortic valve can be recommended to decrease the symptomatology of patients with stenosis. Also, the use of clopidogrel can be used to prevent the post-surgery bleeding, but studies recommend not to use clopidogrel with other anticoagulant drugs.
The symptoms of aortic stenosis are classically the patient has shortness of breath, but in addition to that, they can also develop chest pain. And those are concerning symptoms once a patient has severe aortic stenosis. The third symptom patients can develop is that they can actually pass out or feel lightheaded, like they're going to pass out. All of those are concerning symptoms to us because once a patient begins to develop those types of symptoms, it could be, in many circumstances, the fact that they're getting worse more quickly, and they certainly require evaluation by their cardiologist about the possibility of needing aortic valve replacement. In patients who develop aortic stenosis, the valve can become calcified, rigid, and hard. There are patients who are actually born with only two leaflets, called a bicuspid aortic valve, and that's a congenital lesion. Typically, those valves actually work fairly well to normal throughout most of the early and middle part of adulthood life, but later on, because of the abnormality of the valve becomes rigid, thickened, and becomes calcified, and that's when we have to intervene. Patients who develop aortic regurgitation have a whole host of things that could be causing the aortic regurgitation, which includes things like connective tissue disorders, a malformed valve from the beginning. A bicuspid valve can occasionally be regurgitant. You can have both aortic stenosis and regurgitation together.
Conclusion. This study was undertaken to investigate the roles of anticoagulation alone or with an antiplatelet agent, in this case clopidogrel, after transcatheter aortic valve implantation. It was found lower incidence of serious bleeding over a period of 1 month or 1 year with oral anticoagulation alone than with oral anticoagulation plus clopidogrel in patients undergoing TAVI who were receiving oral anticoagulation. This means after the transcatheter aortic valve implantation, it is not recommended to administer clopidogrel to the anticoagulation treatment. Thank you so much.